Thank you very much for your time. Now, we know that last week, Ivermectin, which is a veterinary drug, was approved for use once you'd got this application 21 in and you'd received permission. My understanding of what happened today is that now, as a doctor, if you feel it necessary to use it, you can put the application in but use the drug in the meantime. But you've just been telling me off air that it's not quite that simple. So explain it very simply to us here.
Okay. Firstly, I want to just confirm Ivermectin is not only a veterinary drug. It has been used in humans for the last 40 years, and 37 billion doses have been given to humans. So it's not a veterinary drug. It is for human consumption. It has been registered in South Africa for humans. The registration has lapsed. So because it's not currently registered, it has been registered, we have to apply using Section 21. And that was always the case. That has always been the case. However, a Section 21 application is an 8-page document. You have to submit that to SAHPRA after you pay 300 Rand, and then they are supposed to respond to you, telling you whether you can or cannot. But that was for cases for lice, for scabies, and for parasites. Last week, we were told that we are allowed to apply for COVID-19 on a compassionate controlled access program. And when we got details about that program, it is exactly a Section 21 with added admin. And the admin states that we now got to send an SMS to them saying that we have now submitted an application. Now, on an urgent basis, it doesn't matter whether Section 21 or compassionate controlled access, doctors were always allowed to use their discretion, and in an emergency, they can prescribe the drug without waiting for feedback from SAHPRA. But where's the gray area? If SAHPRA does not respond to you, or if they do respond and they say to you, you're not allowed to use it, and you've already given it to that patient, and they do have an adverse reaction, or the patient dies from COVID-19 complications, who is liable? And that is the reason why it's not made any simpler. Saying that we can use it on an urgent basis also is very complicated. Because as you know, Sally, Ivermectin can be used for COVID-19 for prophylaxis, early treatment, and during severe illness. But we know that the studies are more positive early on. So the emergency for Ivermectin is in anybody that you want to use it for. It's always urgent.
All right, so explain to me why AfriForum, in media articles that I'm reading, is claiming today's urgent application an absolute breakthrough. What is the breakthrough then if it's just the same amount of paperwork?
Well, I don't want to comment on what they've done, but we were also in that application as a joinder. My group, which I represent, called I Can Make a Difference, the doctors that have signed the letter that I sent to the president. And after we came out of the court and we got information regarding our case, a lot of people were sending me messages saying, well done, you guys have gained a victory and it's now legal. So I put out a video on social media. And on my video, I asked SAHPRA to meet with us on an informal basis so we can discuss this and we can move forward. And just before we got on air, I got a message from my attorney who's engaged with SAHPRA's attorney, and they have agreed right now to meet with our group on an informal basis so that we can discuss going forward, because that 8-page form that takes 1 hour to fill in is not a reasonable request. So why AfriForum has come out saying that, I have no idea, because to my knowledge, and all the doctors in our group, we were discussing it most of the day, nothing has changed. Perhaps now they're getting more people to be interested in the drug, right, and more people will be requesting it from their doctor.
I hear you. Let's boil it down to the patient. Let's say I have COVID. I come to you and you go, you know what, Ivermectin's going to help you. Would you prescribe it and then pop the form in the meantime if you were faced with this decision tonight? Or would you go, heck no, I'm not prescribing Ivermectin, because if I give this to you and you don't survive, I'm going to be liable? What would you do?
Well, Sally, here's the question. Remember, Ivermectin is still illegal. So where am I getting the drug from to give to you? So if I'm going to fill in a form or I'm going to give it to you, the mere fact that I am in possession of Ivermectin tablets right now makes it illegal. So by me filling in the form, I will definitely not risk that, because right now, everybody is faced with the same situation. And if I give it to you, I will give it to all my other patients, because for me, any use of Ivermectin is an urgent use of Ivermectin. So if I have to fill in a form for you, or if I have to give you the drug, where did I get it from? Because nowhere in South Africa can you get ivermectin tablets legally at this point, to my knowledge.
Yeah, as you explained, although it has been registered for nearly 40 years for humans, the registration has currently lapsed. But of course, there is this paperwork saying that you can get it on compassionate access, etc. So I want to ask you again, do you believe in this drug? Do you believe it can make a difference for COVID? And what difference does it actually make?
Oh, definitely, I believe in the drug. I mean, I've been doing a lot of research around it since it became such a big thing. It has been used in South Africa in our hospitals from June, July last year. And when SAHPRA deemed it illegal in December, that's when we all started looking at what is the problem. And there's a lot of gray area because of the registration lapsing, and it's such a cheap drug, etc., etc. But if you go and look at the data which is available, it is so promising. That is why some people call it a wonder drug. We're not saying it's a wonder drug. We're saying it's an option. And I would love to prescribe it for my patients. I would love to be able to give them hope, but I also want control to be able to give it to the right patients in the right doses and at the right time.
Well, it's really good news that the South African Health Products Regulatory Authority wants to talk to you. That suggests there might be some compromise in the offing. So do keep us posted. Thank you so much. That was Dr. Nasiba Kathrada from the COVID Home Management Team. It seems that today's court development's not as simple as it's being made out, but that certainly is a developing story.